The Walsh family has been through a lot together. Siblings Steve, Beth, Mike, and Kathy lost their father to a heart attack in 1986. Then, at age 46, Steve was diagnosed with stomach cancer and died in 2006. 4 years later, to the day, their mother Mary succumbed to colon cancer. After enduring so much heartache, Beth, Mike, and Kathy made an extreme and potentially life-saving decision. Through testing, they discovered they each carried a rare cancer-causing gene mutation, and each chose the dramatic step of having their stomachs removed to significantly decrease their odds of developing the disease. And I'm joined now by Beth Lambert and her brother Mike Walsh, along with Advocacy Patel, a genetic counselor at Mass General Hospital. Welcome. So, Beth, I can't even begin to understand the decision-making process. On the one hand, I imagine it was relatively easy, but it must have been very harrowing to decide that you're going to remove your stomach. So how did it start? Yeah,
and it does sound that way, and I think about this a lot, how before we knew this was part of our lives, when someone first started talking to us about this, it did seem shocking. But when you realize what the alternative is, it's not as big a deal. And so in our family, we found out through our brother Steve, who was diagnosed with stomach cancer at stage 4, and he didn't have any options. And so
which is frequently the case, that the stomach cancer doesn't present itself until the end stages.
With stage 4 stomach cancer at that point, and yes, you're right, it often will not show up, and Advocacy can speak to that a little bit more, but really it's not a good situation to be in. And so he passed away, and a few months later we found out that we had this mutation, and we heard we had heard rumblings, but honestly we were so focused on just, we were losing him and just kind of getting through that grief. And so in June, he died in November and June of 2007, we found out our results. And I think at that point, when we knew that those results were coming, we knew that it was not going to be a difficult decision, because having watched him suffer, to us it was really, we always say it was a no-brainer, but it really was, because we didn't want to have to go through that. And really, he was able to save our lives through his suffering, so we're lucky.
So Mike, give me a little insight into what the procedure is like, and how do you adapt living without a stomach? Because you will say it's easier than people think, because you can actually live without a stomach, you can eat.
Yeah, I'll tell you, before this, I thought the stomach had a lot more different functions than it actually does, and really concerned. But after we had the surgery, adapting to it just took time. We had to eat smaller portions and really readjust to it. And it was, I guess, what I would attribute to basically the reverse of dieting. You really have to focus on eating small portions and getting food in you. And it can be a lot of work, a lot more work than I ever imagined.
Because essentially what happens is, if I'm correct here, the esophagus goes now directly into the intestines. So there is no filter, there's no storage. So you have to pay careful attention to how much and how quickly you're eating every day.
Absolutely.
Yeah.
Advocacy, first of all, what is the screening process like?
So the actual genetic test it's a simple blood test, and what we do in terms of trying to identify families like Beth and Mike's are to go through a family history evaluation. So looking carefully at who in the family has cancer, what kind of cancer it is it all related to each other. So in particular with this condition that this family carries, these individuals are at increased risk for diffuse gastric cancer, and in some families lobular breast cancer. So we look for a pattern. Once we identify that, perhaps...
Let me just back you up for a second. So does somebody have to come to you with this sort of family history? Because I was reading through my research today thinking, I mean, it's fairly terrifying, especially if the end result is you can know what genetic mutation you might have, that I can only imagine that people must be sort of rushing to you to find out what could be lethal in their future.
I think there's both. I think there's some patients who are very motivated to learn this information. They feel empowered by it because they will take action based on what their results will be. And then there's other patients who've had a very traumatic experience with cancer and loss in the family. And for those individuals, it may be a little bit more uncomfortable to talk about the death and dying that has occurred in the family because of cancer. So we see both spectrums in terms of individuals trying to come in to get this data, and then others are just not ready for it.
And then what is the decision-making that goes into a case like Angelina Jolie or these two, that they have to take drastic measures, the removal of a breast or the removal of her stomach?
I think the main key points that our patients consider is, what will they learn from this genetic test, and will they do anything with the information? And then knowing before you actually get your test results in terms of what the options are, whether it's increased screening or surgery, depending on which disease we're talking about, allows our patients to kind of think ahead in terms of what the end result will be from getting the test results, or what their end path will be in terms of getting the test results.
And Beth, how do you look at this now? Because I know that when your stomachs were removed, there were precancerous cells. So it basically confirmed that this probably would have developed and it had the same effect that it had on your brother. So how do you reconcile all of what you've gone through?
Well, we're really lucky, and people are always surprised to hear us say that, but we really are blessed to be able to have, not many people are given a second chance at life and can say that with certainty, but with Mike and me and our sister Kathy in Texas, we all had precancerous cells growing on us. And one of the things that's really allowed us to kind of make sense of it all, I guess, is to do what we're doing now, is getting the story out there and getting the word out. And we've become involved with No Stomach for Cancer. I'm on the board of directors for that. And we're really just trying to raise awareness. And I think people remember information. I could give you a lot of statistics right now, and I would rather not. I'd say go to the website, nostomachforcancer.org, because that's where you're going to really be able to process things. But I think what gets people's attention is like Angelina Jolie and these stories getting out there, because they're real people. Stomach cancer or any cancer, it's not about statistics. It's about moms and dads. Those are all people. They're all lives that have connected with us, and we want to make sure people realize that. And the thing that we always really tell people about is to know your family history, whether it's stomach cancer or heart disease or anything. When you start talking to each other, and that's what happened in our family. Steve and my mom both had cancer the same year. We had no idea that colon cancer and stomach cancer had a connection. And breast cancer, and that's the thing with this mutation, there are 3 cancers associated with it. We want to make sure that people are talking to each other and then go to the genetic counselors and get that.
Well, that's what I wondered about as well. If you have the genetic mutation for this cancer, for the stomach cancer, does that mean you're at further risk for other cancers?
Yeah, so the main tumor that our CDH1 carriers are at risk for is diffuse gastric cancer, and that risk can be up to 80% or even a little higher. But then there is, for our female carriers, the risk for lobular breast cancer, which can be as high as 50 to 60%. And then there is evidence that is where we see more anecdotal evidence that perhaps colon cancer could also be part of this disease spectrum. So those are kind of 3 tumors that we look for to see if this is a condition we need to worry about.
Okay, and I just have just a few seconds left, but I want to ask you, you all have children. Your brother, who passed away, had children. Are they going to have to, or have they already made the choice to do the same?
Those 3 have been tested, and 2 of them tested positive. They haven't taken the next step yet. Our kids, when they're in their late teens or later, when they're ready, will be tested.
When they're ready to deal with it, they'll get tested.
All right, well, you certainly have raised awareness. So thank you for coming today.
Well, thank you for sharing the story. We appreciate it.